Getting so many questions on perineal massage, so I figured I'd make another video just to explain everything in further detail. First and foremost, the perineal massage is done in order to improve the elasticity and the stretch of the perineum. And so basically that's the area between the vaginal opening and the anus. The perineum is prone to tears during childbirth. Of course, you can have tears elsewhere, but this is the most common place. And typically, the studies show that if you do perineal massage starting at around 31 to 32 weeks every day or every other day for the rest of the pregnancy, you can decrease the percentage of tears or the intensity or how big the tear is. I typically have my patients instruct their partners to perform the perineal massage. If you don't have a partner or if your partner's unwilling, there are other things you can do, like using the Frida tool, which I will go into later in the video. There are some studies that show that you can start it earlier throughout the pregnancy. I typically don't start my patients until 31 to 32 weeks. Most common questions are, will I stretch too much? Or is this bad to do? Answer is no, you won't stretch anything too much. It's a good thing and your body will bounce back, contrary to what society tells us that the body won't bounce back. Misconceptions as well that if you already gave birth, then you can't do this. That's also not true. You can do this as many times as you want with however many pregnancies you have. And you could do this postpartum. If you do have a tear, you can work on perineal massage after 6 weeks to kind of improve the tissue and make it hurt a little bit less. Of course, you should always ask your doctor before doing this. Most doctors will give the okay, and most doctors will do this during the delivery in the delivery room. So again, this is where the perineum is. This is where I'm stretching. And if you look here, basically I'm taking the tip of my finger. I'm not going far in at all. It's really the tip of my finger. And I'm starting right here. And I'm pushing down on this area. Actually, I don't know if this is a better view. Pushing downwards and stretching. Gentle stretch to the side. Gentle stretch opposite side. And you can hold the stretch. I'll typically do like 3 to 5 rounds of 20-second holds on both sides, 3 to 5 rounds of 20-second holds. You can also go a little bit higher, so 3 to 5 rounds of 20-second holds like this. You can also do sweeps, so you'll do like this and hold moderate sustained pressure throughout the entire time. So moderate sustained pressure, upwards, upwards. Some people like the clock example. The clock is literally, you imagine 6 o'clock is here. So you would do 6 to 4, 6 to 4, 6 to 8, 6 to 8, stretch at around 7, stretch at around 5. All of this is going to be gentle pressure, moderate. I would say, like, if you imagine a peach, you wouldn't want to break the peach skin, but you would put enough pressure where you're kind of putting a dent. You don't want to put too little pressure where you're not putting a dent at all, but you're putting a little bit more pressure. And it's moderate and sustained holds. You are not going to enjoy this. This is not like a soothing, relaxing massage. It is kind of painful. It kind of replicates what people call the ring of fire, which sounds a little bit scary, but just stay with me here. The ring of fire is basically a sensation of fire as the baby is crowning. And so you'll get a very like modified version of this with the perineal massage. It feels like burning. So that is a normal sensation. Of course, you don't want to be in excruciating pain. So like if you are in excruciating pain, you should don't do it as hard, but it should be like a little bit uncomfortable. You feel like you're getting a stretch. This is linked in my bio, but basically you can use this tool to help yourself do this. So you would basically use this part of it to do the perineal stretching. So you would use this part and start here and stretch outwards. I also have my patient's partners perform the perineal massage in the position that the patient wants to birth in. So if you know you want to birth in quadruped or in all fours or in a squat position, you can have your partner practice the perineal massage in those positions so your body knows how it feels and so you're prepared. Use lube or coconut oil. I don't necessarily recommend olive oil. A lot of people ask about that, but I don't know how much research is on that. This helps. Cheers.